Hi, Eileen Veilleux, the fam here. Welcome to another installment in our mini mental health series. In this installment, we will be continuing our series on melancholic depression. If you can recall our first series, part one of it, we went through the cause and symptoms of melancholic depression. Now, on this one, we are going to cover the diagnosis and treatment for melancholic depression. But before we begin, let me remind you to please watch the full video, because throughout the video there's going to be 3 key words. When I get to the keyword, I will say keyword, then what the keyword is. At the end of the video, in the comment section, put down what the 3 key words are to be eligible for my free merch giveaway when I reach 2,000 subscribers. So let's get started. How is melancholic depression diagnosed anyway? Do we know if there's a certain diagnostic thing that they do to tell if you have it? Well, your doctor will start with an evaluation to accept the nature, keyword, severity, and duration of your symptoms. Some of the questions your doctor may ask will include: how is your daily routine change? Do you still enjoy the things that you used to do? Do you have trouble getting out of bed in the morning? How do you sleep? Are your symptoms worse in the morning? Is it difficult for you to concentrate? And is there anything that helps improve your mood? The doctor may also evaluate your physical health by performing some tests of blood work to check to make sure your symptoms that you're having are not related to some type of underlying medical condition. So in order to be diagnosed with melancholic depression, an individual must exhibit symptoms of keyword major depressive disorder, such as feelings of persistent sadness, loss of interest or in pleasure, low energy or fatigue, irritability, appetite changes, sleep difficulties, changes in activity levels, difficulty concentrating, and thoughts of dying or suicide. To be diagnosed with melancholic features, you must have at least 3 of these symptoms: depression that is different from grief, weight loss or loss of appetite, slowed activity or restlessness, keyword excessive guilt, waking much earlier than normal, or more severe depressive symptoms in the morning. Your doctor will also rule out other conditions or issues that may be considered include bipolar disorder, cyclomatic disorder, persistent depressive disorder, disruptive mood dysregulation disorder, premenstrual dysphoric disorder, depression caused by illicit drugs, prescribed medications, or some physical illness. Okay, so how is this treated then? Well, for melancholic depression, medication is often part of the treatment plan because it is believed to have a biological root. In other words, since it is usually not triggered by outside circumstances, causes of melancholic depression appear to be mainly due to genetic makeup and brain function, necessitating a medication that works on biological causes like brain function. Types of antidepressants that may be used for melancholic depression include selective serotonin reuptakes, which is better known as SSRIs. These medications work by changing the way the neurotransmitter serotonin works in the brain, thereby improving mood. Calming types include Prozac, Paxil, Zoloft, and laxapro. Serotonin neuroendocrine reuptake inhibitors, better known as SNRI, affect the way both serotonin and norepinephrine work in the brain. Forgive my pronunciation if I said it wrong. Common kinds are Cymbalta and Epixer, otherwise known as venlafaxine. Now, norepinephrine and dopamine reuptake inhibitors, NDRIs, are like Wellbutrin, is the only medication in the class that affects norepinephrine and dopamine. Atypical antidepressants, these medications affect brain chemicals, which seem to improve mood. Examples of medications in this category are Remeron, Alipro, Trazodone, Trintellix, and Vibert. Now, Trintellix antidepressants, better known as TCAs, these are first-generation antidepressants and may have more side effects than the newer versions. This class includes Topranol, Pamelor, and Amitriptyline. Also, monoamine oxidase inhibitors, MAOIs. This is another older class of antidepressants that can have serious side effects, but may be a good option for certain people. The main medications in this class are Parnate, Nardil, and Marplane. Now, research suggests that melancholic depression responds better to tricyclic antidepressants than to SSRIs, psychotherapy, or interventions. Now, is there any way to cope with this? How do you cope with this if you have it? Well, because melancholic depression is characterized by such profound feelings of sadness, loss of pleasure, and lack of interest in daily activities, it can create a major disruption in how a person is able to function in many areas of life. If you suspect that you have melancholic symptoms, you should always talk to your doctor. Antidepressants are the first line of treatment for this and can be very effective. There are, however, some things that you can do to help manage your symptoms and complement medication-based treatments, like lifestyle modifications that may be able to help your mood may include getting regular exercise, spending time with friends and loved ones, eating a healthy diet, meditation, following a consistent sleep schedule. But it is always important to remember, however, that the symptoms of melancholic depression can make all of these things very difficult. Once your medications begin to take effect, you may find it easier to start incorporating these changes into your daily routine. So this is something that you just can't do it without proper medical help. So if you think you have melancholic depression, please, I implore you, reach out to your mental health therapist. If you don't have one, call them. Tell them what you're feeling. Tell them what's going on. Remember the questions that they'll ask you. Answer them to the best of your ability. Because these mental illnesses are nothing to play games with. Always, don't ever try to do it alone. If you're nervous and scared about seeing a doctor, have a friend go with you, or a family member, someone you feel comfortable with, but have them go with you for your support. It's always a good idea to have your support system with you. because your support can help you when you're scared, when you're nervous. They can give you encouragement. Always have a support system, whether it's your better half, another family member, a close friend, but make sure you have a support system set up. Because mental illness, untreated, can lead to suicide. Especially with this, because this is, when somebody has it, it is so overwhelming that they just don't have any energy. They don't feel like doing nothing. They don't feel loved. They don't feel needed. They don't feel wanted. And there's nothing that can be said or done to change that unless they have medication. Once they start taking the medication and that kicks in, then they can start getting back into their daily life activities slowly, as it suggested. Maybe starting off by, okay, the first week you take it, you get out, you start exercising. The second week you add something else, and so on and so on. But remember, you can't tell what a person's going through just by looking at them. You don't know what's going on inside their head. You don't know what their life has been. And it's not our place to judge. Somebody says something you don't like, okay, you think they're a crazy witch or they're an a-hole. But are they really? Do you know what's going on inside their head? Do you know what they're going through in their life? The best thing to do is, before you make judgment on anybody, be there for them, support them, and say, hey man, this is not like you. I'm here if you want somebody to talk to. Let them know you're there. Don't criticize them. Lift them up and encourage them. Try to help out. Now, if you try to help out, if they say, yeah, well, I suffer from this and that, but I don't want to take my medication no more. Still try to encourage them to take that medication. Let them know. Say, man, you're going to lose all your friends because this is what's happening when you don't take your medication. And you're going to be pushing everybody away. Try to be their support. And then if none else fails, where it's just getting worse and worse, and you can't personally do anything about it, if you know somebody, get in touch with their family and say, hey man, I know he's not taking his medication and they're just getting worse and worse, but my hands are tied. But don't pass judgment on them. As I said in this, with some of the medications, they have serious side effects. So a lot of people don't like taking the medication because of that. At that point, if we know somebody like that, we should encourage them. Well, tell the doctors that you're not happy with the side effects and you want to try something else that has less side effects than this, or milder side effects, and see if they can do it. But always encourage them to take their medication. And remember, never do anything alone. If you're the one suffering through it, reach out. I'm here. There's friends on YouTube. If you don't have any close friends and you don't feel you can trust anybody from YouTube, whether it's me or somebody else, reach out to a close friend that you know you can trust, or a family member. But never, ever go through anything alone, because you matter. Yes, I'm getting close because I want you to know from the bottom of my heart, you are important to me, each and every one of you. I see you out there, you, and you. You are all important to me. You matter. And I want to be there for you. If not me, that's fine. Choose somebody that you know and you trust deep in your heart. I don't pass judgment on anybody because I'm far from perfect. I want to be there to help people in any way I can, whether it's just listening ear or a shoulder to cry on. I mean, yeah, people need to vent sometimes, and that's all. Sometimes that's all they need. It's just somebody to sit there and let them vent. And sometimes it's a little bit deeper where they need a shoulder to cry on and somebody to lift them up and encourage them and say, hey man, I know where you're coming from. But never let anybody do it by themselves. If you think you know somebody suffering from anxiety or anything, even if they just need somebody to talk to, offer your help. And if you're one that's going through that, I'm here to help you. There's others out there to help you. If you're not comfortable talking to us, reach out to somebody who you are. Okay? But remember, always see with your heart and not with your eyes, because your eyes can deceive you. What matters is invisible to the eyes, because only the heart can see. And until I see you again, love you. Bye, everybody.